I'm Nonia Ganya, and I'm a family nurse practitioner. I've practiced for just about 16 years. Prior to that, I was a registered nurse for about 10 years. I currently practice in the retail clinic setting in the state of Virginia, and I co-owned a practice for about 7 years in New Jersey. Prior to that, I was actually a nurse's assistant just for a few months. And that was when I really started to understand patient characteristics and the way we as healthcare providers engage with patients. It really does make a difference, the way we engage with patients as a means to help patients begin to trust our services as healthcare providers and actually genuinely begin to connect with us. So for close to 30 years now, it's fair to say that I've maintained some sort of contact with patients in so many different capacities, either in subacute settings or in hospitals, outpatient clinics, in home care settings, and currently in retail clinic setting. And as a nurse's assistant, I remember that it really was not very difficult for me to engage with my patients. Patients were usually what I call their true selves. They would talk to me very easily. There wasn't much reservations when patients engaged with me. But as I became a registered nurse and now a family nurse practitioner, I just found that patients were a little more hesitant to open up in front of me and build trust with me. Sometimes I would attribute that because patients are a little bit scared of an authority figure as a registered nurse or a nurse practitioner, and it's now up to us to engage patients in a way that will bring out their true selves and make them really feel more comfortable in our presence as healthcare providers. So this observation that I realized over the years that the healthcare experience generally brings out a lot of anxiety in so many patients. It really did not hit home for me till I became a patient myself. In 2013, I underwent a very extensive surgical procedure that debilitated me for quite a while. But while I was a patient, all the different anxieties that I felt actually made it easier for me to begin to understand the patient's anxieties when they do present to me, when I, as their healthcare provider. So this experience just kind of made me realize that some of these anxieties that patients present with can come out as attitudes, because if they are not addressed properly or if they're not channeled the right way, it could present as patient attitudes. So I'm sure so many of the attitudes that many of you as healthcare providers have encountered in your patients may actually be due to underlying anxiety that the patients do not know how to portray. Some of these attitudes can make a patient become an opinionated patient, a suspicious patient, a dependent patient. It can make a patient become an angry patient, an impatient patient, sometimes a very talkative patient, just amongst so many others. But do you know, as a healthcare provider, that there are ways, very strategic ways, that you can engage with your patients, to make them feel comfortable in your presence, to improve the chances of them developing trust in you as their healthcare provider. So these are those strategic ways that I am going to talk about in this series. And it's a 3-part short video clip, like I said earlier. And in the later part of the clip, I'm going to discuss some of the characteristics of these patient attitudes, and also, more importantly, the best way to engage with each patient who presents with such attitude to improve our chances of developing trust with the patient as their healthcare providers. And in my book, actually, there are 16 different scenarios that I have detailed, and these different characteristics and the different ways to engage with each patient attitude are also detailed in the book. It's available on the site ptdrsimpletips.com. It's also available on Barnes & Noble and Amazon. The title of the book is called Simple Tips to Developing a Productive Clinician-Patient Relationship. You may be asking yourself at this point, so how can we achieve this? We are so different. How can we really genuinely begin to connect with people and make them feel comfortable in our presence? We are living in such a very diverse world. We have different nationalities, different languages, we have different cultures, different religious backgrounds, we have different moral values even. So how can we begin to genuinely connect with other people? And I'm here to tell you that it is possible. It is possible because one thing I've realized over the years is that despite the different attitudes and the diversities that exist between us, one thing I've realized is that patients that present and have similar anxieties when they present, they tend to act the same way despite their diversity. So that made me really realize that we have to focus on the anxiety that patients present with and find ways that we can engage with them to alleviate some of these anxieties for us to make true connections with patients despite the diversities, because it's really not about it's not about our diversity at all. It's about the underlying anxieties that make us act the way we act. So the next short clip after this one will talk a little bit more details about those simple acts that we can begin to implement when we connect with one another, when we communicate with one another, that will improve our chances of genuinely connecting with our patients and improving trust between healthcare provider and the patients. And today I'm going to briefly touch on the characteristics of the few of the common patient personalities and attitudes and attributes that I have come across in the past 30 years in the healthcare setting, and also the best communication approach, the best interactive approach that has helped to make me develop trust with patients who present with such attitudes. And the first patient I'm going to talk about is the dependent patient. And the dependent patient is one who rarely contributes to the medical decision making or the consultation process. And sometimes it could be cultural, it could be the patient's personality. I find a lot of patients who are introverted tend to become a little bit dependent when they are in front of the clinician. And sometimes there is that fear of authority that I find also with dependent patients. And what the clinician should do once this is recognized is try to engage the patient in small chit chats, based on the patient's interest. You can find out the patient's interests, their jobs, what it is they do for a living, things that just interest them, because you find that when you engage a patient in something that interests him or her, they tend to loosen up. And you find that this is the best time to now delve into a consultation process with the patient. Do at all times try to avoid questions that lead to abrupt yes or no answers, because that's exactly all the dependent patient is going to be doing, is shaking their head yes or no without giving much information. And the next patient is the impatient patient. The impatient patient is one who comes in and just wants to speed up the consultation process for whatever reason. Sometimes they have other appointments to keep, they have to go shopping, they have meetings to attend, so many reasons I don't have any control of as a clinician. The first thing to recognize is that the clinician should make sure that you are not going at the pace of the impatient patient. You're not going to rush the visit on their account, but rather find a way to make sure that the patient understands that a thorough assessment is necessary so that you don't overlook any important thing. And there are very strategic ways of doing that also. So never accommodate the request of the impatient patient. The next patient is, patients who are parents this time. I fondly call them the Dr. Moms and Dr. Dad. I am one myself. I am a Dr. Mom. And patients, parents rather like this come in. They do have the best interests of their children, of course, but sometimes you find that they become almost overly enthusiastic about the visit. And the first thing clinicians should understand is you should never really underestimate the input of an enthusiastic parent. You should always make sure that you are letting them know rather that you as a clinician value their input and you have their child's interest, the best interest of their child at heart. But at the end of the day, you want to incorporate their input into your clinical decision making, because you have to try to maintain control of the visit as the clinician in this case, because parents like these do tend to really appreciate clinicians who value their input but still maintain control, of the clinical decision making. The next patient is a patient who is a healthcare provider. I remember many years ago, in my younger years, when I would, consult with a patient who comes in and tells me, oh, by the way, I'm a nurse, or I'm a doctor, I'm a dentist, and I would just freeze up. I would just be terrified because all these things would go on in my mind, and I would just think of things like, oh my goodness, I don't know, I hope I treat this patient right. I have a feeling this patient knows what I know, so I make sure I don't make a mistake. And things like this can actually begin to distract you, and a patient can pick up on that. The most important thing I've realized over the years is you have to just very briefly interact with the patient, to talk about their own background as a medical provider, because it generally helps to break the ice. And try not to focus so much on the social chit chats with patients like this. Focus on the clinical decision making, and patients, as time goes on, will begin to trust you as their healthcare provider, even though they are healthcare providers themselves. So stay focused. That's really the most important thing I've realized for patients like this. And this is just a brief introduction. There's really way more about these patient categories, and these are just 4 of those categories. In my book, there are 16 categories, and such categories like the angry patient, you have the opinionated patient, you have the overwhelmed patient, the defiant patient, the talkative patient, obese patient, skeptical patient, you have the normal patient. And I know probably a lot of you have read some of the blogs that I wrote about the suspicious patient. The suspicious patient is one, who generally comes in, and typically that first consultation visit, there's a lot of reservations that you as a clinical provider may not have any control over. The patient may not generally trust your clinical decision making, either because of your age, your gender, it could be your nationality, your race, it could be your religion, but there are very strategic ways of engaging with patients also who present in this manner to make them trust you as a clinical provider and develop trust as time goes on. And it's all found in my book. My book is called The Simple Tips to Developing a Productive Clinician-Patient Relationship. And the characteristics of these patients that I just detailed are found in this book, and the best and most appropriate communication style to help improve trust can also be found in this book. It's really a 2-part book. The first part, I wrote a lot of things that I directed towards the patient this time. The simple do's and don'ts that patients can implement to help make a visit a productive one. Things like do write down your questions so that you can stay focused when you are speaking to your clinician. Don't do extensive internet research about your symptoms and ailments, because you're just going to cause yourself unnecessary anxiety, and that will deter you from having genuine conversations when you're talking to your clinician. This book is available on ptdrsimpletips.com. That's my website. It's also available on Amazon and also on the Barnes & Noble links that I will put up at the end of the post. It's available in an ebook, in soft cover, and also in hardcover. Thank you so much for joining me. Let's all go a step further than just communicating with our patients. It's time to really genuinely begin to connect with our patients, because that's only going to help us build lasting clinician-patient relationships. And our patients will thank us. They'll thank us, and they will really mean it this time when they thank us. Thank you so much again for joining me, and I all hope you have a wonderful day. God bless.